Hello and welcome back to the Layback podcast. Joining us today is Taylor Black. Taylor currently works at the Monarch Athletic Club as a physical therapist. Prior to that, he did live a brief career as a baseball player, registered 4 years playing college ball. He is a native just north of the San Diego area from, if I'm not mistaken, in the beautiful beach towns that I would love to retire to one day, but he has found his way back in California after a stint with the San Diego Padres, working mostly on the minor league side as a physical therapist. And of course, Taylor knows his background a lot more than I do. So I'm going to kick it over to him and let him explain everything from there. Thanks again, Taylor,
Right
for coming
on.
on.
Thank you very much, Adam, for having me. I appreciate it. Yeah, so my background started in physical therapy a long time ago, actually, junior year of high school, even sophomore year, I had an injury. And that kind of got me opened up to the realm of physical therapy, being able to go ahead and use the creativity side of what the body is capable of, and then the human aspect as well to get you back to a rehab and back to the field, per se. I broke my ankle sliding into second base, and that put me back quite a bit, honestly. And then had a great relationship with my physical therapist, and I was like, hey, this is definitely a possibility, something I want to do for my career. And it was a great way of being able to be on the field, be working with athletes, and be in the sports realm and get back to what I do love, which is baseball and football at the time. So played baseball in college at St. Joe's, had a good 4 years there, studied exercise science, uh, got my bachelor's degree, and then got a CSCS, went the strength and conditioning route, and always knew I was going to go into the physical therapy realm. Went to Northeastern University, graduated with my doctorate in 2021, and kind of started having some conversations with some professional baseball teams. Went short stint in a long-term acute care, actually, working post-op with VA patients, working with stroke patients, and having to see that real life kind of struggle that they were dealing with to be able to just be able to get in and out of bed and walk to go grab their water. So that was like very eye-opening. And I knew I wanted to still go with the professional baseball route, and was able to land myself with the San Diego Padres. Growing up in San Diego is a dream come true. Always wanted to work with the Padres, whether it be getting drafted or in the rehab side of things. And I ended up being able to fulfill that. Now I'm over at Monarch Athletic Club. I work at the Brentwood location in Los Angeles, and I'm the physical therapy department head right now. It's been a very big pleasure working here for about 16, 17 months, working with Gen Pop, youth athletes. I have a few athletes that are trying to qualify for the Olympics this year in Paris. So very exciting times as we are moving forward towards June and July.
Yeah, you certainly have your hands full. It's a weird transition, I'm sure, going from professional baseball to more of a general open population group where most of the injuries or ailments or anything that you're working with in the baseball world, it's almost like rinse and repeat. Of course, the athletes are individuals and you have to adjust for their specific needs, but I'm sure it's relatively a similar cycle versus what you're seeing with the general population. I bet it's likely kind of what do we have in front of us today? Is that fair?
100%. Yeah. So working with the San Diego Padres, you are seeing mostly wrist, hand, elbow, and shoulder injuries. Probably worked with 2 or 3 knee injuries, but you're also seeing a lot of strains, hamstring strains, oblique strains as well, lat strains as well. So like being able to see that, but it's mostly upper body. More likely than not, the most common injuries are actual muscle strains in professional baseball. Literature just came out regarding that. But you're also obviously seeing your UCL sprains, tears, shoulder labral pathology as well. But working here in the Gen Pop, I'm working with ACL reconstructions, Achilles tears, whether that be a ankle or malleoli fracture, but then also some tendinopathies. We have a very large golf population here. A lot of people at some great clubs as well, so I've been able to get out golfing with them. So it's been very nice and challenging seeing all these different patient population or pathologies that I've been working with lately.
Right, you're really checking the box on every population from VA to professional athletes, now everywhere from youth all the way up to those training for the US Olympics. That's pretty incredible. You're gonna have a very impressive resume behind you very, very soon.
Yeah, it's been solid overall. It's been challenging too. We have a great team here, being able to collaborate twice a week to say, hey, I've been having troubles with this said person, this athlete, whatever it may be. And we all collaborate together. That's something that brought me here to Monarch Athletic Club, being able to have that collaboration because we have strength and conditioning staff, we have a full PT department, and we have medical and nurse practitioner on staff as well. Very cool, holistic approach, what we're working on here right now.
Yeah, it sure looks like it. Obviously, I follow you on social media and I've seen some of the stuff that Monarch has put out in general. One of the things that I've always appreciated that you have done specifically is you share your journey, whatever you're working on at the time. I know you were a little limited with that when you were in the professional baseball ranks, but if you go back before that stint with the Padres, you tracked all your training, you could follow what you were doing on social media, and now even through your own leg injury that you suffered through, we were able to kind of rehab along with you or follow what you were going through. And I commend that immensely because I love a coach, a professional, anybody who is willing to grind along with the athletes or continue to learn. And obviously that's what you were doing. Yes, you were forced into it this time with your own knee injury, but I think you do an incredible job opening the door for new opportunities to learn, grow, train, try new modalities, or just mess around and find out along the way. Uh,
Yeah,
yeah, what have been like cool discoveries for you in that process?
Yeah, it's been very challenging with my knee injury itself. I've actually never treated a patellar fracture. It was what I dealt with in August of 2023. And actually, three or four people have come in into the clinic and been able to, like, hey, I know this person. Do you have any tips and tricks for them or any resources that you found most beneficial and most important during their rehab? And I was fortunate enough to work with a couple of those people. But being able to have that background and being able to work alongside great teammates here, but also working as yourself, like grinding it out, like you said, being able to get you from point A to point B and have that real like experience that your patients are going through day in and day out. Like the first 2 weeks absolutely were miserable. I was on a desk chair scooting around. Sammy was gone and she wasn't able to help me. So I was like just honestly miserable, just grinding it out on my own. And then like my patients that are post-op ACL reconstruction day 5, their knees swollen, they're in significant pain. They may live by themselves. They may have a dog, and being able to relate to them and have that interpersonal communication with them is like essential so they can see like, hey, Taylor went through something similar. He's able to grind it out and he can kind of relate to me. Has been very opening for my patients, being able to say, all right, let's get bought in. Let's have this trust with this person, my physical therapist and rehab in front of me, and be able to get them to where they need to be, whether that be back on the basketball court, running a personal best on the track, or just playing golf day to day.
You kind of took me on the segue I wanted to go on anyways. Maybe a little bit earlier in the podcast, but we love that. That's the point of going back and forth here.
There we
One
go.
of the things that I definitely wanted to get into today was what I witnessed of you in Peoria when we were with the Padres. And that specific thing was your ability to have that human connection with the guys you were rehabbing. And that's not to say others weren't doing the same thing, but it was something I picked up from you right away, whether it was you were the first one to grab a glove to go out to play catch with a guy who needed to go through a throwing program. You're on the floor of the weight room with them as they're lifting. You made it a very strong effort to learn Spanish and communicate with guys from other nations while you were there. So I really just want to open up the book on the human aspect of rehab. There's so much that goes into it. Of course, there's a science to this, there's an art to this, but the human connection is utterly important. And I think you do a great job of that. So I just kind of want to open the floor for you and let you rip.
Yeah, I appreciate that high praise. Thank you very much, Adam. Comes from a young age, just like growing up and bopping around from moving from state to state. I think having to get put into different situations and being comfortable with new people. I've lived in multiple states, about 7. So I think it kind of comes from when I was very young. And there's actually always a knock on me, like in school and stuff. I was always a little bit more talkative and I didn't think I was professional. But I think having those soft communication skills is essential in the rehab community, especially in professional baseball. You're seeing those people 6 or 7 days a week. They're not going to have good days every day. So you have to be able to read that person in front of you and be like, all right, let's go ahead and push a little bit more aggressively today, or let's go ahead and pull back. Maybe they didn't have good sleep last night, or they're having some relationship issues. So being able to connect with these people that are in front of you and rehabbing in probably one of their lowest points in their life at this moment in time, they're not doing what they love to do, or they're limited in whatever it may be, from like daily stuff, even like that takes a very big mental hit on people. So rehab and getting back to where people need to be is obviously psychosocial as well. There's a huge component in how your brain and body perceives pain. If you're thinking you're never going to get better, like more times than not, you're not going to get back to where you need to be, like prior level of function. The goal is always to get past prior level of function, because you're here injured for a reason. Was the tissue underprepared? Did you poorly sleep? There's so many, it's multifactorial. So being able to hit all those spots is paramount. And then most importantly is like, are you connecting with the person in front of you? Are you truly listening to them, and are they being heard? And like you said, like being able to learn Spanish or brush up on my Spanish skills was paramount to me and very important, because like if I'm not be able to communicate with somebody in front of me, like what if if they don't feel comfortable telling me the whole story, right? Or where their pain is, or what they feel when they're releasing the ball, or when they're talking back and stuff like that. It's like very important to get every single detail possible, and building that trust there is just like, it's the most important. Like you see with the younger guys too, with in ball clubs, or even I work with a lot of youth athletes right now, being able to see that buy-in and see like, all right, we're showing slow progression. Obviously no progression is linear, but if you have that buy-in from that person in front of you, they're going to be ready to go. And like, all right, Taylor's telling me to do X, Y, and Z. He's doing this because it's in my best interest.
Digging deeper on that point you made about you are interfacing with these athletes likely at one of the lowest points of their life. It is the reality, especially in the professional world, or as you get higher up in any sport. The individual is often more tied to whatever they're doing from an identity perspective. How do you or anybody in that situation who is there to offer a helping hand able to assist an athlete and understand that they're more than just their elbow not working, or they're more than just their shoulder?
Exactly. Yeah. So like having that conversation of like, look at these small little victories we're able to um, perform from day in and day out, whether that be being able to get in and out of the bed, or being able to weight bear through their arm. Just telling them like, hey, you were this person beforehand, like this is who you are. And then being able to create that mindset of like, all right, I'm able to perform all these different things from day to day in activities, and then slowly building upon those kind of small milestones and showing like, all right, this is what we're dealing with. This is going to go ahead and build some character at the end of the tunnel. As long as like it seems so far away, like I felt the same way, like I was millions of miles away from that end of the tunnel during my rehab. Like we're going to get there. It's not going to be linear. It's going to be very painful and very difficult, but like this is going to be able to get us to where we want to be and where you want to be, and showing them like, hey, there's more meaning in life, and this is going to be, you're going to look back from here like 5 to 10 years from now, like, wow, I was able to conquer this, and it was mentally challenging, physically challenging, but like being able to look back and step away, like look at all these small victories and see where you were once at day one. Now you're at call it day 35. Like look how much progress you've already made. Even though it doesn't feel like a lot, there's a lot more to it.
And another piece on that I want to go to is kind of the community around an individual or in that rehab setting. One of the first guests, well, actually the first guest we had on the Layback podcast was Joshua Paulina, obviously a previous Padre.
There you go.
And one of the things that we discussed was the difference between his first TJ rehab and his second. In his first TJ rehab, he had once he got beyond high school and showed up in Arizona, he could look to his left and look to his right and see big leaguers next to him, double A guys next to him, or other rookies alongside him that were going through the exact same thing. And then, I mean, I remember walking in the training room, and it was the Peoria Gorillas. Like everybody had this like culture. They were just going to get super big. They were going to get super jacked. They were in it together. I loved seeing that versus Paulina's second rehab that he's still fighting through now has been a little more solo because he's now in the college setting. There's so many fewer guys that are fighting back from the same injury that he had. I wanted to bring this up to kind of open the door for you to discuss the importance of like that community in rehab, even if it's not somebody dealing with the exact same thing that you're dealing with, but how you can find people to lean on.
Yeah, that's great. Having that community, actually, there's things in just like general life, they're called blue zones, and how people are living longer throughout their lives in certain portions of the world because of having such strong community and identity with that community, being able to relate to one another and like be able to get lean on somebody, like you said, and get that information like, oh, I'm dealing with this, my elbows discomfort, whatever it may be. Like, hey, what were you able to go ahead and do to kind of help that out or make it feel a little bit better, or being able to talk mechanics on when they're going through their throwing program or on the mound. So it's that team orientation that is going on in the professional realm, which is very important because you're feeling like you're not feeling outcasted, or you'll be able to relate to somebody that's right next to you. Like maybe you and another guy went through a UCL reconstruction within about 2 or 3 weeks. Be able to like, all right, this guy's 3 weeks ahead of me. What were you dealing with? Were you dealing with this nerve discomfort in the ulnar nerve, or like did you have tingling and sensation when you were throwing the ball? So being able to have that gives that person reassurance. Be like, okay, this is normal, or this isn't normal. Let me speak up to the physical therapist, the athletic trainer, whoever it may be that will be your person there. And then also talking about community and collaboration is very important on the other side, on the rehab facility side, right? So we have plenty of physical therapists, athletic trainers, rehab coordinators, strength and conditioning coaches, pitching coaches, everybody that's seeing the sports scientists, seeing the person that's in front of them, seeing how they're throwing. Like, all right, let's go ahead and have this conversation. What are you seeing out on the field? What were you seeing in the rehab room? What were you seeing on the S&C side of things? Like, so having that collaboration and community on the other hand as well is paramount and very important for these people and these athletes to get back to where they need to be. So just being not feeling that isolation is very important, and just having that communication to get you feeling better, feeling more reassured, which creates more confidence, and down the line you're going to be where you need to be.
So now countering that, you are in a setting where you might have an athlete that feels like they're rehabbing solo, whether it's a high school kid, college kid, or somebody from the private sector, like one of these Olympic athletes training on their own. They're coming in for training or care specifically from you. How are you able to create something similar or offer that similar olive branch to create that area of peace or community for somebody that might be grinding solo?
Yeah, that's a great question. What I try to do most is we have treatment rooms like I'm in right now, private, quiet. Some people do need that, other people don't, right? So it comes back to being able to read a person. Like, all right, were they having a good or bad day? Let's go ahead and bring them in the private room, kind of down regulate their nervous system, let them relax a little bit more. Or we have a gym right outside where some more treatment rooms are. We have 15, 20 members in here at a time, just ripping weights and getting strong and stuff, and being able to have them being brushing up next to those other people that are not rehabbing, but that maybe that be their goal to be back lifting these heavier weights. So creating the environment is very important as well. Being able to have them see other people's success is kind of invigorating for them. Like, okay, I can definitely get back to that. Or being able to share some stories like, all right, I'm dealing with this youth athlete. He's having elbow pain. What are some experiences that I had as a player, or some other people that I was able to rehab that were on the younger side of things, and be able to like, all right, they dealt with this. This was a setback. This is one of the largest life events that you're dealing with right now. It's going to get better, but just creating that reassurance and confidence in the person is very important for them.
I like understanding that. And I suppose when I went through my own injury recovery from my shoulder, I always felt alone in the process because I got hurt after I had already announced that I was transferring from this first school that I was at. So I couldn't like go anywhere to have an athletic training room even. It was all on my own or through a physical therapist or anything like that. Even though I went back to the school that I intended to leave, like yeah, I had my same friends, I wasn't leaving my friends. I was just leaving for another opportunity in the baseball world. But because I left the athletic program, I had to rehab on my own. I think that's something I suffered from personally. I didn't understand the importance of kind of creating that around me. I didn't take that on. I would encourage any athlete that's rehabbing to take the step, like put yourself out there, say like, yeah, I would love to be on a team, quote unquote, while I'm rehabbing, whether it's created in the physical therapy setting or if it's just an online community, something being able to share in that process working forward.
Yeah, having a voice is like that's part of people's identity as well. Like being heard is important for people's recovery and rehab, and like just being able to banter a little bit, even to like give somebody else a little bit of hard time of whatever it may be, or have that competition brings out the best of people. So very important for sure.
Well, while we're kind of in this lower point, we're talking about kind of the struggles right now. I definitely want to hit on another piece. You already said you've been a part of some of the low moments. I want to, if you're comfortable going through it, and if not, we can jump ahead, kind of discuss what setbacks might look like and how you've been there for an athlete, whether it's you are having to be the bearer of bad news or you are the shoulder for them to lean on to help them out of this moment. What does that look like? What are some of these situations? And maybe how can they be avoided or how can we circumvent them?
Yes. So I would say try not to avoid them because like you got to give the person in front of you the truth and like what's going on with their body. But in this setting, we'll talk about first, I would be more of the bearer of bad news per se, but then we go ahead and get a second opinion because you can come in for 45 days as a physical therapist here in California, get treatment, and then get a diagnosis from a physician as needed to get more physical therapy. But in the professional realm, I was more of the shoulder to lean on and like be able to be there for that person. That's going to be a little bit higher up, working with the physician or orthopedic surgeon. They will go bring them through everything, MRI and imaging. So that would be a no-no, always being able to be like, all right, this is what we're seeing. We're going to go ahead and have said person give you an evaluation, and then that person would be able to like, all right, according to imaging, my evaluation, this is what we're seeing. And then they would make that decision. So we would be able to go ahead and be there for that person and be like, all right, now that we've found out what's going on, we can go ahead and make a plan and attack this together. So being able to like just be there for that person is challenging. Like we've talked about being in these low points and lulls. It's very, very difficult for that person being able to like, all right, we're not going to push them every single second, right? Like obviously the goal is to get them back as fast as possible, but if we're not getting them back healthy and ready to go, is it a couple 10 days worth it? You don't know.
Now, going into kind of a specific example, of course, we're not going to name any names, but what I would like if you can walk us through maybe an athlete goes out for a throwing program. Maybe it's week 3 of the throwing program. Everything seems pretty solid to date. They're progressing, and they have to shut it down mid-session because they say they feel a lot of tightness in the forearm. What's kind of the process from there, or what do you do from the instant the athlete brings that up when you're 90 feet apart on field 2 of whatever complex you're at to a month from then, or just how's that play out?
Yeah, it's all dependent on what the injury is. And then like, let's pretend I'm playing catch with that person, being able to see like, how has their control been during that time. And if as soon as they vocalize it, we'll go ahead and shut it down, have them do an evaluation, bring them into the athletic training room, be able to see what's truly going on. And then we'll go ahead and work up the chain as well, have that great communication throughout the team approach, being able to collaborate with everybody. Like, all right, I'm seeing this, let's get another physical therapist on it. And like, let's see what you're seeing. And we can kind of bring our heads together and see what's going on truly. Then it goes up the chain, of course, gets back to the rehab coordinator, and then also obviously up to the coaches and surgeon as well. Obviously, not every instance is needed for surgery. Say it's a post-op case, then that's more alarming. But having that increase in influx in like workload, right, is like, hey, I haven't thrown a baseball for 5 or 6 months, whatever it may be, based on what protocol you're using. It's going to be like very alarming at first. If it's your week 3, you're like, wow, I'm already dealing with this. Like, so that's very challenging. And then depending on what everybody else is seeing or what is going on, we'll go ahead, move them through, kind of not bring them backwards at all, but bring them back to baseline. Goals to decrease pain first and foremost, make sure the range of motion is good, and then start to build up and load up that tolerance or tissue capacity is paramount. So we're finding a tolerable entry point for that person and be able to get them to where they need to be to back on the 2-hand plyos, 1-hand plyos throwing a baseball, so on and so forth.
What would maybe be the red flag in the situation that might call for imaging needed again, or versus if you were just going to, like you said, kind of back them up a step or two, try to return them to baseline, maybe flush inflammation, and then just go back and hit it again? Where's the divide there?
Yeah, so it's based off symptoms and patient presentation, honestly, being able to like, what are their symptoms? So they're dealing with like ulnar neuritis, burning and tingling down the area. Are they tender to palpation at the sublime tubercle, where the distal attachment site of the UCL is? So it's kind of what they're dealing with at that time. You look at it that day, and then after about 48 to 72 hours, every day you're checking them out, but being able to see where they are, have they progressed during that time? And then reconsider like what the next best step is. So being able to see that numbness and tingling is always a little dicey there. And then did they hear any audible sounds as well? It's very important. Did it feel like their arm went like kind of dead or numb? Is challenging too.
Thank you for digging a little deeper on that. I appreciate it. I do think that is super useful to understand, especially for those who are rehabbing on their own, whether it is worth just taking a breath, taking a day or two, or trying to elevate it quickly and get into a doctor. Of course, a medical opinion is never really going to be the bad decision, but I know it's also very hard to put yourself in a situation to feel like the boy who cried wolf.
Yeah, it's very challenging to figure out, is this serious? Is it not? More times than not, rather be safe than sorry, because that can elevate to something more aggressive down the road, whether that be an elbow injury, some neurological discomfort or symptoms is very challenging as well.
We've kind of dwelled in this negative energy for a while. So I want to flip it over to positive. And I'd love to just hear about maybe one of like your favorite wins since getting in the physical therapy world. What's something that like you're coming home, you just had the biggest smile on your face, like we're celebrating like we won the World Series. What does that look like for you?
Yeah, we'll go professional baseball first or sport oriented, and then we can go another route as well. But like being able to get people back on the mound, and like obviously that first throw during their throwing program is paramount and so crucial. But being able to get them on the mound throwing 100% intensity and velocity is just like so cool to be able to see. Like they were grinding 5.5 months, just being able to like rehab every single day, decrease pain, get that range of motion back. Like getting that range of motion back is so important in rehab because that's going to go affect everything up the chain and down the chain as well. So if we have normal osteokinematics and being able to get those small little victories first, they continue to pile up when you get down to throwing a baseball off the mound at month 9. It's like, wow, this is like the coolest thing ever. We're getting somewhere, like velocity is getting back up. I'm stronger overall. But like each person goes through it, and like being able to see them get on the mound and like throw their first bullpen again, it's like, honestly, it's like makes me feel so good. That's kind of what got me into physical therapy, was being able to help this person at a low point and then get them back to where they want to achieve in that goal, whether it be throwing a baseball or playing tennis or golf or whatever it may be. So being able to get that person from the lowest point in their career to the highest point, or back to the potential of getting that highest point to where they need to be in their career, is just like so rewarding. And like you see the work that you put in and they put in as well is just awesome. And then probably one of the bigger victories is like working with a patient who suffered a stroke and getting them to walk for their first time was like the coolest thing of my life. Like in the career and like rehab standpoint, like being able to get them walking from room to room is like just so rewarding. And you see their smile on their face, moving about, maybe with an assistive device or whatnot, but it's just so cool. Like, hey, like they're telling all their friends and stuff. So it's really cool.
Yeah, it's really hard now to go back to asking questions about baseball when you talk about getting someone to walk again. Like apples and oranges. I feel like we're
Exactly. That's why we went professional baseball first, and then into that.
yeah,
So, but it's
I
just so rewarding, and just seeing the accomplishment in their face as well. It's just nothing beats it.
that's kind of the ultimate trump card in here. Like, yeah, that's the coolest thing I feel like you can do in this setting. But I am going to try to bring it back to the baseball world the
As you
best I
should.
can. One of the things that you brought up that has been a reoccurring theme recently on the podcast has been the idea of stacking good days or celebrating small victories. It's a big topic on the Nick Fanti episode, came out last week. But I know from your perspective or the seat that you're in, you kind of have to be the one that throws those victories in the athlete's face often because it's so hard sitting in the athlete's seat to think, or it's so easy to think the only victory is getting back on the bump, throwing 95 again, having the uniform on, and striking a guy out or whatever, completing the first inning again. Versus from your seat, it's the regaining range of motion of the elbow. It's, hey, we performed a push up today, or you were able to eat with your dominant hand. Like it's, I'm sure that's kind of a funky spot to be in where you are Mr. Positive. Yes, you have to be pragmatic with everything you do, but I'm sure you always have to approach it with that positive light. So how do you handle that from your position?
Yeah, it's definitely challenging. I have a fortunate background in like being more upbeat, kind of positive guy, glass half full. So being able to do that's a little bit easier on my end, but that's where like reading a room is like, is that person ready for that positive news, or like, who cares if I got 90 degrees in elbow flexion at that moment in time? Read the person, like they maybe were in a little bit discomfort or pain when they're getting into that range of motion, so they might not be too stoked to hear about that. So let's read that person, push it down, like maybe later that day, like, dude, I'm stoked for you. You're able to get 90 degrees of knee flexion and full extension on the, or elbow flexion, excuse me. And just being able to like read the person in front of you, and just always, they will tell you what they want to hear, and then being able to listen to them as well. So it's like, so give and take relationship regarding that. And my outlook is very positive. So sometimes I have to tone it back, and like somebody just had a really crummy bullpen session. They don't want to hear it from me right now. So let's go ahead and look at them the next day, or talk to them about that nice win that they were able to get full range of motion, whatever it may be.
Yeah, that makes sense. I suppose if that's going to be a character flaw, I suppose that's about the best possible character flaw you could ever have is like, yeah, that's the guy who's happy and excited too much. He's too
Yeah,
positive.
it's tough sometimes, but there is time and place for sure to pull back. It's been some feedback of mine, so I really try to be mindful of that, and be able to give that person what they need at that moment in time.
Totally, but you do back it up with significant schooling, a large background in the field. Your education is second to none. I love that in our conversations. We can just be like jabbering back and forth, and then all of a sudden you bring up the ossification process of like post
Yeah,
surgery or something like
yeah,
you just like I'm pretty sure I've seen those words before somewhere.
yeah. Got to just be able to bounce back and forth. And some people want to get nitty gritty about kind of the details of what's going on like the cellular level, or like, dude, I don't care. Like, just like tell me how to get better. So
Yeah,
you got
I
to be able
suppose
to wear
that's
two hats.
yeah, that's really important from the rehab process. Like you said, it's reading the athlete. I mean, I could tell you if you were in control of my rehab, I would want to know everything that's going on from the medial epicondyle, the sublime tubercle, what my attachments look like, everything like that. Versus I'm sure that you have others that step in the room and they're just like, am I better today or am I worse today? Just tell me yes or no.
Exactly. Yes or no. It's like black and white. So like, and then that comes like, it's nice to have those two different athletes and patients in front of you, because like that will push my education further for continuing education opportunities, being able to learn a little bit more about the shoulder or elbow, whatever it may be, from people that are much more knowledgeable than I am. So like if you're getting stuck and not learning more, I try to read a journal every week, whether it be on the elbow, shoulder, knee, whatever it may be pertinent to us that we're seeing here in clinic or what I'm interested in about. You're going to get like left in the dust. So like being able to look out to those mentors that I do have and like reach out to them, like, all right, this is what they're seeing or this is what their experience is, and being able to pull from them as well. That kind of team community as well is very important for me to continue to learn and be able to provide the best care I possibly can at this moment in time.
Do you think that's decent advice to pass on to an athlete that they should, or at least be encouraged to share how much they want to learn in the process or how much detail that they need to understand what's going on?
Yeah, so it's kind of like twofold, right? Like they will tell you as they show how interested they are during your conversation. So you can pull from that. And then I like to go ahead, like my understanding is like, what questions do you have at this moment in time? And then they will, if they start smoking with some questions, you know, they're really bought into their body and how it functions. So it's always who's the person in front of you, right? So being able to like start that conversation off and like during the evaluation, what's going on, and then kind of see how that makes them feel and go from there.
Cool. Yeah, well, I feel like at least for this moment, we've done a pretty solid job talking about the pro population. I know you're passionate as well about what's going on in youth sports right now. And you can open any article on elbow injuries right now, and no matter how hard dudes are throwing in pro ball, no matter what pitch they're throwing, any of that, there's always going to be a paragraph that goes back down to, well, youth players are throwing more than ever. They're not obeying these pitch counts. They're playing more games. They're not practicing. They're not training. And this is something that I know you've looked into, you care about, you want to make a difference in. So, again, this is your time to take the stand. There's not really a question, but give us the introduction to Taylor Black's position on youth sports, especially in the baseball world.
Yeah, well, to speak, I'm most passionate about youth sports in the baseball realm for sure. Just looking at like pitch counts, like you mentioned, and educating the parents. Like, you don't need to educate an 11-year-old right now. You just have to educate the parents because they're the ones driving them to six baseball games over the weekend, and then going on Monday and like throwing the 45 pitches after throwing 60 or 75 in their travel game. So being able to educate the patients and being able to send them literature or conversate them about literature of like the likelihood of these athletes getting injured down the road if you're playing more than 10 months of the year is significant and like statistically significant, especially. These people are increasing their rates of injuries, these kids 3 to 5 fold if you're playing 10 months per year. So it's just like educate the parent first, and then maybe they make a decision of like, all right, I want my kid to play in the base MLB, but like what other options are there that we can improve agility or strength and stuff of that nature? So like, let's get them in football. Yes, there's injuries probabilities there, but it will reduce the risk of injury of the elbow specifically. And then there's some literature out there as well talking about, I think it's like or 65% of the MLB players on active rosters in 2022 did not specialize in a sport. A lot of the players are playing soccer if they're from different Latin countries. They're playing soccer, they're playing other sports, playing beach volleyball, staying active and working on hand-eye coordination, but also letting the arm rest. So being able to look at both sides of things, like the parents, you just got to educate the parents first and then be like, hey, this is actually a possible epidemic going on right now with all these people having these medial elbow injuries and discomfort at freaking 14 years old, 13 years old. Like little league elbow is not supposed to be happening at the rate it is.
I have potentially an interesting response here, and maybe this can spark a little bit of a debate even. I'm going to play a slight devil's advocate position, and that is, what about an athlete who self-selects into early sports specialization, especially in a state you're in, like California or Texas or Florida? There are so many kids that are, their passion for baseball is unrivaled at the age of 11. The coach that I used to coach under in college, he talked to me not too long ago about his son is experiencing a good bit of arm stress for kind of the first time in his life. Thankfully, it's something that kind of can be it can be completely managed non-surgically, so everything's good there. But the kid has self-selected to specialize in baseball because it's what he loves. It's not that he doesn't like hanging out with friends or shooting hoops or anything like that, but the only thing that he really wants to pursue is baseball. So how do you take that case or that athlete, that family, where a kid only is in love with that one sport? Yeah, they'll go run around, they'll go do other things, but how do you, from your position as a clinician, make recommendations to that specific family?
Yeah, that's definitely challenging because I've met plenty of kids here out or parents out here that their kids like, I love baseball. All I watch is baseball. I'm watching Tatis highlights or whoever it may be, and it's just like baseball, baseball, baseball. So with that being said, you got to look at like try to get the kid to play as much as you can. Like create an environment for that kid to have competition outside of a baseball field without a baseball. Create competition in other ways with their friends. Go play in the ocean. Fortunate enough, we're in LA. Ocean's right down the road, so they can go ahead and swim. That's a great way. And if obviously they're going to want to play as much as they can, but then creating, hey, like it's very important to get this person in the weight room as well. There's good research out there to get this person as strong as possible, as mobile as possible, working these end range strengthening positions to be able to be strong in these positions so they can kind of tolerate the tissue demand that they're looking for when you're playing baseball. So creating different seasons throughout the year, try to like when it's the winter time, try not to play baseball because like you're gonna want to pick up a baseball to get you prepared to throw come springtime, but like get that person playing or have a great off-season program. Here at Monarch Athletic Club, we're trying to roll out a youth development program in the coming months, which is very exciting to go ahead and educate these younger athletes. We're looking for like 13-year-olds and up and right before they get to high school to create good habits down the road so they can go ahead and take care of their body, sleep well, fuel it well, get strong as heck in the gym so that hopefully can transfer over to the diamond or soccer field to reduce injury. We're never going to prevent injuries per se, but we can hopefully reduce the risk of injury.
Okay, so now let's put you in this case as a parent. Theoretically, you have
Yeah.
a child 12 years from now that is committed to baseball. Just that's your child's passion. What do you do now as a parent? What is your ideal calendar year? If you can
Yeah.
break that down for us, what baseball season, off season, when they would ramp up throwing, when's competition, and your child, I'm sorry, but at 12, your child already decided baseball's for me.
Yeah.
Don't even want to touch anything else. So I guess
First and foremost,
congrats
yeah,
on having a
like
passionate child, but
there we go.
sorry you have to deal with that.
First and foremost, I'm thinking like, I got to stay athletic and in shape as best I possibly can, honestly, so I can go ahead and play with that kid, or with my kid, not that kid, play with my kid and be able to be active as much so I can kind of shift their mindset to other things. And maybe we try something different that they kind of open their mind to, like, oh, this is actually fun. How will I like maybe playing golf or whatever it may be? Like working on rotational, it's a rotational sport, right? So we're be able to increase some power that way as well. So opening up their mind to other things, as long as I'm doing it, it's more times than not, kids look up to their parents, right? So being able to go ahead and show them like, hey, I'm working out in the mornings in our garage gym or whatnot, being able to show them like lead by example would be very important for them to get to maybe opening their mind a little bit. Going on the like the seasonal approach, let's go with like November, December. They're 12 years old. Starting like a nice smooth throwing program to start working our way up. Throwing just like twice a week at the start, 60 to 90 feet. Every throwing program is different if you're injured or if you're healthy. So being able to ramp that up is needed. So healthy 12-year-old kid, we're looking for starting maybe throwing at November, being able to throw right after Thanksgiving and slowly ramping that up. Say we're starting baseball practice or tryouts in February, just so they can build up to throwing about 4 times per week is very important. And then obviously, I think in Little League, you have at least 1 or 2 days off. So being able to tolerate the 4 to 5 days per week, go throughout the springtime and season ends in May, so you're healthy throughout, and then take a nice hiatus, like 2 months, go on a vacation or something like that, and then being able to be outside, soak in the sun, staying active. No 12-year-old doesn't like swimming, to my knowledge, but being able to be in the water and doing like water activities is always very fun. Growing up myself, being near the water, so being able to find those different things that the kid could possibly like is very important. And then more times than not, players or kids are playing fall ball as well, which is like great because they're able to go ahead and see more pitches, work on whatever they're trying to work on during that time. So that gives us what, February to May or June. That's 3 months there, and then another 2 or 3 months in the fallish time. That's only 6 months there. So we're still abiding to that less than 10 months per year. So looking at that there would be kind of something I would think of for being a parent one day.
Well, now congratulations. You've recently been named commissioner of the local 12U baseball program. So now you have to make additional decisions. Whether it's adding strict pitch counts, whether it's putting position restrictions on athletes or different things of that nature. If you were thrown in such a position where you had to manage a youth baseball league, are there things off of the top of your head that you would implement?
Yeah, so I was actually just talking to a patient recently regarding their kid, and I think he's 11 years old. And like, hey, what are the pitch counts right now? And I think it's about 75 pitches, and you have to take 4 days off. But I think like maybe even like having 6 days off, or like you only can pitch once a week with when you're throwing that much volume could be good because these kids are needing sleep, and most kids are fueled, let's say, and they're not being able to eat as much food or they're not eating the quality of food that they need to recover so their body can be ready to go for that high intensity demand. Because like when you're a kid, you're trying to throw as hard as you freaking can because you see all these pro guys throwing as hard as they can. So being able to have I think it's 4 days for 75 pitches, maybe adding a fifth or sixth day of rest is very important. And then you start a game, don't put the kid behind the dish and or play shortstop, right? That's common. I'm sure you did that growing up. I did that as well. Let's go ahead and put them at first base or something like that. Or maybe now they can only DH. It's a very challenging spot. Like players, coaches are in at the little league level because everyone wants their kid to do so well. The kid wants to do so well. They put so much pressure on it because like this is a way to go ahead and make a career or living, or they're just so passionate about it. But educating the person, like, hey, if you want to get to where you want to be, like rest is not a bad thing. We've created this mindset of like how important like the grind set mentality is. Like all these adaptations occur when you're recovering, not when you're throwing a baseball or lifting or whatever it may be.
Yeah, I think you bring up a couple really cool points there. And now we're going to expand a little bit from youth baseball based on what you said. So if you weren't done on that, I apologize, but
You're good.
there's a couple points I definitely want to bring up. One of which is what you talked about regarding workload. And on another episode recently, we had Casey Mulholland on from Kinetic Pro down in Tampa, and he is a workload genius when it comes to the acute to chronic workload ratio. One of his big passion projects right now is making sure that the industry recognizes that workload is not necessarily designed, or tracking it is not necessarily designed to prevent people from competing. It's designed to help them compete at their best. So it's designing prep work that helps get them to a certain point to better perform, which I think calls on exactly what you said of, that pitcher that threw 75 pitches, it may be smarter, even though a sheet of paper tells them they can come back and throw again 4 days later. At 12 years old, they're probably beginning puberty. They're probably dealing with tests in school and homework and the guy or girl they like and everything that's going on, that stress is finally impacting that young life. So managing workload is not designed to prevent this child from playing or competing or trying to win or be the best they can. It's just trying to provide bumpers or guardrails to ensure that when it is time to go, they can do it at their best. Do you have anything you want to add to that, or other words that you might feel could express it in a different way?
Like you said, it's not like preventing the person. Maybe like say a professional baseball player needs an extra day of rest, their arm feels a little bit dead, whatever it may be, like being able to create maybe during like a throwing program, create a deload week a week prior to when they were scheduled on it based on their presentation. Having the acute to chronic workload ratio is paramount. You see it in soccer as well, actually. These guys are running 6 to 8 miles, depending on their position, like, and the hamstring strain or ACL ruptures are so prevalent based upon it's usually goes like you see these hot running high numbers. I think it's like 1.2. You see them running these high numbers, and all of a sudden you're like, next week they blow their UCL out, they blow their ACL out, and it's very challenging. So it's like, let's go ahead and create a deload week or more modalities to get them ready to go ahead and make sure they get back down into that more comfortable range.
Yeah, totally. I definitely just wanted to bring that up because it will continue to be important for us as an industry to express, given the platforms that we have, that these workload limits or these stress limits are not designed to prevent people from competing or enjoying what they do. It's supposed to be safety guidelines to enable them to do it more often and do it better in the perfect
And
world.
safer, right? Just
Yes.
like having like a TrackMan, it's giving you more information and more data points to be like, okay, why are your RPMs lower today, or why is the induced vertical break a little bit less compared to your last bullpen on Tuesday? So having those more data points is very important. Some people get like paralysis by analysis, but for the sports science background, the physical therapist, the rehab coordinator, like, all right, we're seeing these downward ticks. Let's go ahead and give this guy a little bit of a break so they can go ahead and ramp back up.
Oh, that's an awesome point. And now I just want to flip everything and go down that rabbit hole. Were there
Yeah.
cases that you've been involved in where you maybe noticed something other than velocity change on a TrackMan report that you have then had to make an intervention for an athlete?
So not directly by myself, of course, but being able to, like, the rehab coordinator has access to acute to chronic workload ratios and all these spreadsheets and stuff, and then being able to see, say their IVB is down. Is that because of a grip? Is that because of like flexor fatigue or pronator fatigue? What's going on there? So maybe we can go ahead and work some isometrics, or that's where flex pro grip can come into play, right? Being able to increase tissue demand or tissue quality and intensity to go ahead and slowly ramp up the nervous system. Again, maybe they're doing that for kind of a pre-throw routine now because you want to get the nervous system activated and firing a little bit more so you can go ahead and start ripping that fastball or whatever pitch they're trying to go for.
That's really cool. I like that a lot because, of course, I mean, I love TrackMan. I love that stuff. And I know you
Yeah.
do too, being a bit of a baseball nerd yourself. But understanding the additional applications of these tools is just so intriguing. The fact that you can take something that is always seen as a player development tool or just something that flashes really cool numbers can actually help the medical team make more informed, better decisions.
For sure. Yeah, it's really cool. And we're still just scratching the surface, right? With all these analytical and data points that we're able to obtain. And like getting people into like 3D motion capturing systems is awesome too, to check out torque, elbow angles upon release, and like cervical rotation or flexion or extension that they're doing while they're releasing a ball. There's literature out there regarding like if you can't flex your neck and rotate it past 39 degrees, passive test, like your increase of elbow and shoulder injuries are like 3 to 8 fold if you're lacking just neck, cervical flexion and rotation, which is absolutely insane, right? Everything works together. The thorax has to go ahead and work with the spine. The spine has to go ahead and work with the shoulder and elbow. If you're not proximally stable, like what's going to happen distally?
Well, offline, I think I'm going to have you send that research to me because that's the stuff
Yeah,
I
definitely
really
can.
get off on.
There we go.
Now at this point, I want you to go any route that you want in terms of what's exciting you, whether it's research coming down the line, it's a passion project you are working on individually, or just something cool in the life of Taylor Black. What you got?
Yeah. Two things, like passion project, the kind of touched upon it earlier, creating a youth development system here at Monarch Athletic Club. I think that's going to be very important for the West Los Angeles area. There's so many people and like talented athletes out here. Being able to set them up for success, and whether they get drafted, go D1, or whatever their passion is, setting them up for like good habits down the road is what I'm super passionate about. Because when I was like 12 years old, I always wanted to play baseball in the professional realm. Didn't have that guidance per se, and then didn't start like lifting seriously until like junior, senior year. So being able to instill that in these youth and younger populations, very important to me, to see what they're truly capable of and kind of get the best out of them. And then it's been interesting too. Like I've seen a lot about, like I was watching baseball, Sunday night baseball. I think it was the Dodgers Padres game. They had a cool little graphic of like 13% of pitches thrown in 2007 or 8, I might be wrong, were above 95. And now it's like 36% of pitchers are throwing 95 plus each pitch, which is pretty crazy to think. And then the RPMs like significantly up as well via TrackMan. So those are really cool things to see. But like, how are we going to be able to reduce the risk of injury? I saw Tyler Glasnow mention, like, are they going to just they're not going to pitch with 100% intent during each pitch? Intent as in intensity I'm talking about. Are they going to try to pitch more like a Greg Maddux, like, who was just like would paint 88 anywhere he would want, and it was just like unbelievable to see. So it's like kind of cool to see which way the professional baseball players and pitchers in particular are going to go. And they took away the sticky stuff, right? So that's requiring these pitchers to grasp the ball harder. It's going to put more stress on the dynamic stabilizers of the medial elbow. So what's that going to do down the road? And then talking about like pitch count as well, I kind of think about it, or pitch clock as well. Like think about it, like imagine one rep maxing 500-pound deadlift every 30 seconds. These guys are throwing freaking 102 miles per hour every pitch. How long are you going to be able to do that for? Like, I can't do that every single rep for 30 seconds, maybe once. No. So like, how are you going to be able to go ahead and bounce back? How is this going to have these players recover better? What are they doing? What new implements for arm care are going to be put in? So there's so many different ways things are going to go in the next 3 to 5 years. And it's really cool that I'm on the rehab part of things to like see, like test and try just with like the youth athletes as well. Like, do I want to get back into professional baseball? I don't know, but I'm very happy with where I'm at right now.
That's really cool stuff. And selfishly, I want to say thank you for introducing three of the things that we have coming down the line research wise with Flex Pro Grip regarding
Oh, here we go.
pitch clock, fatigue, and its influence on pitch movements. And then as well as the Tyler Glasnow approach of sticky stuff is gone. So now we have to increase grip elsewhere or increase that friction if we want the same movement, same velo, same control. So that's thank you. I'm glad to know your brain's going the same place that
There you
ours
go.
is.
So right there for you.
Yeah, we're not on an island with what we're researching, I suppose, which is
No.
very exciting. And then of course, awesome that you guys are rolling out this youth program. That'll be awesome. Are you in charge of it? Like, are you heading up that effort?
That's the goal. I gotta, like, we do a really good collaborative approach here. Talk to the other department heads, owners here, and to see if that's something feasible here. So we're gonna roll it out this summer, and I've been able to get some other interest from other strength coaches and physical therapists here at Monarch Athletic Club to roll it out at our Brentwood location and see kind of how it looks come this summer.
Wow, that'll be cool for the area for sure. And now
Yeah.
before we wrap things up, there's one other thing I definitely want to get into, and that is the Taylor Black Burger Tour.
Oh, my man. I went on one last night.
Yeah.
Yeah, so funny enough, you mentioned this. I love burgers. They're probably like my favorite meal, like to eat out. Not like a nice steak or anything. It's like a juicy, like tasty, like greasy burger. So I've been trying all these West LA burger joints out here. So I went on my sixth one last night. I'm a smash patty kind of guy, and just been able to nice and saucy, quality meat, and dude, get a good burger out here. You know the difference. Out in Arizona, actually, there's a pretty good burger. Arizona Wilderness Brewing Company. They have this like peanut butter green chili burger, and it's pretty solid. So, yeah, I just love a good burger.
What's the best burger you've ever had?
got to give a shout out to my guys over at Heavy Handed. It's in Santa Monica. Funny enough, they're opening up their second location tomorrow. Absolutely crushing it. Dude, just perfect cheese melts, onions, sauce. Just, they do it right.
What is the expectation? What makes a minimally good burger for you? And then,
Like,
of course, I know you need the little special things. Each restaurant has their own twist that
of
makes
course,
something special. But what do you
minimum, I'm
minimally
looking,
expect?
yeah, minimum, I'm looking for like a good bun to burger meat ratio. Like, if there's not enough, there's a few places out here that have more meat than bun. So I'm like, what are we doing here? And then the bun starts to fall apart. We need a really good cheese pull. If the cheese isn't melted, I promise you, I will not eat it. And just a nice sauce, like a relishy, pickly sauce, dude. I'm very passionate about this as well. Passionate about working with youth athletes, baseball, sport, but like I love to eat and cook. So this is something I've been crushing lately.
Yeah, and I guess along those lines, I want you to be able to share your knowledge to the masses. So what ways can either athletes, parents, whoever get in touch with you?
Yeah, that's a great question. So I'm over at Monarch Athletic Club right now. We have two locations. I work at the Brentwood location over on San Vicente. You can just swing on through and check out the facility. We welcome anybody to come in to check it out. And then via social media, I'm on only Instagram right now with my handles tblack.dpt. So I try to post anything I'm going through, like my rehab or anything I find intriguing. I kind of switch it up from time to time, whether it be my rehab or like an elbow injury or whatever. So there's nothing like specific. It's more general and global. So that's where you can find me, trying to spread some good information. Social media has great opportunities to learn some things, but also some misinformation out there. Usually that misinformation, people are trying to sell something. So just be on the lookout for that. I'm just very straightforward. I have no kind of nothing I'm trying to sell.
Performance training, rehab, burgers. That's what the people can
That's
expect.
that's what they will expect. And I'll do some cooking too. I'll put some cooking out there as well.
Yeah, I think one of the better salmon dishes I've ever seen has come through your Instagram account, if I'm not
I
mistaken.
love that.
Well, Taylor, thank you very much for hopping on with us today. Really appreciate what you shared and look forward to continuing our collaboration in the future.
Love that, Adam. I had a blast on here today. I appreciate your time as well, and thank you for having me on.
Of course, and to all the listeners out there, thank you for laying back with us.